Lamar Productions presents Let's Talk 901. Focused on health and social concerns. Top doctors committed to infectious diseases. Renowned doctor and professor of medicine. Medical Class 901 with Dr. Animalu. Memphis, the heartbeat of 901.
Welcome to Medical Class 901 with Dr. Chi. My name is Dr. Chinelo Animalu, infectious disease specialist and HIV specialist and professor of medicine at the University of Tennessee Health Science Center, Memphis. Joining me in the show today is Ms. Betty Lamar. Ms. Betty, it's so nice to have you on the show today. I am so honored to have you with me. Welcome.
Well, thank you. I'm so happy to be here with you on the red carpet. I really am, because you have something I know that's very important to discuss with us today. So let's, I'm going to play the role today like I am in your seat. Tell our viewers, first of all, before we kick off Medical Class 901, who you are and what you do.
So I am an infectious disease specialist, and what that means is treat different types of infections, bacterial infections, viruses, fungus, every kind of infection humanly possible is what I do. And so it's something I'm very passionate about, especially where we are here in Memphis, that we do have outbreaks of terrible infections affecting our communities. So we will focus again on speaking on HIV, because this is something that's huge in the Memphis community. And so today, Miss Betty, we all heard in the news over the weekend, the Shelby County Health Department is requesting major hospitals and emergency rooms in the Memphis area to adopt a system that is called the opt-out testing for HIV.
Okay, opt out. That means if you don't opt out, you opting in automatically? Is that what that means?
Yes, absolutely. So basically what this means is that for everyone that comes to any of the major emergency rooms in Memphis, regardless of what the hospital is, kind of required to test you for HIV unless you decide to opt out and say, hey, I don't want to be tested. And the reason for this, as you all know, is that Memphis ranks number 2 in the country in the highest number of new cases of HIV diagnosis, especially amongst our young folks, our children, from the ages of 15 to 19 and even up to the age of 24 years. And so what this does basically is to help us, come up with new cases, new diagnoses, because HIV is something, it's kind of weird in the sense that it doesn't cause major issues, no symptoms. So you find out that most people that have HIV do not even know they have it.
Okay, now, Dr. Chi, how did we get here? 14-year-olds. I mean, what are they doing? I mean, because, there was a time when this was like a gay disease, right? But now it's affecting anybody that's living whatever lifestyle it is for you to get it in the first place, right?
Yeah, so HIV, there are, several modes of transmission, meaning that there are several ways you can get HIV. The commonest, is through unprotected sexual intercourse. And so that's something that's a little bit worrisome, given the fact that the highest rate we are seeing now is among our teenagers, again, like from the ages of 14 all the way to 19. And so there are other methods of transmission, including needle sharing, or what we call maternal to fetal transmission or vertical transmission, and accidental transmissions that you can see in the hospital settings where perhaps a doctor, a nurse, a lab technician is accidentally stuck with an infected needle. But the commonest and the major issue would be unprotected sexual intercourse. And this seems to be plaguing our younger generation. So we as parents are all worried.
Okay, so what if, say like a young person, there are no symptoms. So can an entire family be infected if, say, like if your 15-year-old is, it's not like we call and ask for permission, right, to do what we do.
Yeah.
So if that child has HIV and they do not know they have HIV, but they're sharing, back in the day, it's like people didn't even want to drink after anybody, do any touch, it was just really crazy at first because we didn't know. We didn't have the information. We didn't have the Dr. Cheese to really calm us down about things. So how does that affect the entire family if one person have HIV and they say they drinking after each other? Does kissing? Is it all body fluids or just?
So you get HIV through transmission of certain body fluids.
Okay.
Most of that would be genital, so it could be vaginal, semen, and other ways. But you're not going to get HIV because a family member has HIV. There has to be direct transmission with blood or genital body fluid. And so that's something that, question that we get all the time. And I want to use this medium and let people know, no, you're not going to get HIV because your family member has that. Absolutely not. It's not something you get from kissing or from sharing utensils or from, body contacts, hugging and, other forms of body contact. No, you don't get HIV that way.
Okay. Well, I'm so happy to hear that because back in the day, there was so many myths and misconceptions out there. People was literally afraid of a person that had HIV because, you thought if you just touched something. And that's what I was wondering about, and I had spoke to my friend about, which, we'll be talking about this show on an upcoming show. But I'm glad you cleared that up because a lot of people are, like I think you said on a previous show, that a lot of people not even tell other people that they have HIV, and you mentioned the stigma. Let's talk about that. Has that gotten any better? Or are people still feeling bad or like they'll be treated badly because they have HIV?
Absolutely. So it remains a major concern, the HIV stigma. People don't understand that what it was like in the 80s is not what it's like right now. HIV is not a death sentence. And because of that stigma, especially in the minority population where people are so ashamed and embarrassed to, identify as HIV positive. And that's part of the problem because what happens is that you hide, you don't get treated, and then you're able to, transmit this infection from one person to another through, mostly sexual intercourse. And so people need to understand that HIV is not a death sentence. HIV right now is just like somebody that has hypertension, diabetes, asthma, high cholesterol, and stuff like that. You take your medicine and you're fine. And so for us as a community, we need to be able to embrace our members, our family members, friends, co-workers, people with HIV, and know that this is not something you're going to get just because you're friends with somebody that's HIV positive or you have a family member that's HIV positive. Absolutely not. We have to work together as a community to get rid of this stigma. We have to be welcoming of the members of our community that have HIV. And that way, that's the best way for us to be able to actually curb this infection, because that way people feel better or easier coming to test and, know your status. You can't do anything if you do not know your status. You cannot get treated if you do not know you have HIV.
That's right.
And so we have to stop criticizing and looking down on our community members that have HIV.
Okay. Well, now, this is what I'm going to do. I know I want to know about PrEP. I want to know about that because I've heard PrEP. And so how about if we take a little break and come back, and I want you to explain to everyone about what is PrEP, what is PrEP all about.
Thank you for watching the Medical Class 901 with Dr. Chi. Dr. Chi MD is a renowned infectious disease specialist in the Memphis community. Without further ado, let's join the medical class with Dr. Chi MD.
So that is why HIV for most part is asymptomatic. So what it means is that you might not know. It's, so what happens is that the initial infection, you might have what seems like to be like flu-like illness, and then it goes away, and then you're fine, right? And so most people will be like, oh, I probably had the flu, and that's it. So it doesn't have any specific symptoms, and that's why we are pushing for people to be tested. So for our younger generations, for older ones like us, if you are sexually active, you need to know your status.
Yes.
Especially, if you are not certain of the person that you are involved with, everybody needs to get tested. That's the only way you can know. The times where you become symptomatic, meaning you start, having symptoms or falling sick, would be the end stage of it, which is called the AIDS. My name is Dr. Chinelo Animalu, and I am an infectious disease specialist out of Methodist University Hospital and a professor of medicine, Division of Infectious Diseases at UT College of Medicine. Welcome to Fun Facts with Dr. Chi. I am Dr. Chinelo Animalu, infectious disease specialist and professor of medicine. So we're going to talk about just some basic points to know about HIV. So what does HIV mean? Human immunodeficiency virus, which is a virus that we can pass from one person to another through sexual intercourse, or sharing body fluids, or through blood transfusions, or by sharing needles. About 39 million people are affected worldwide, and it's a major cause of mortality in the world, meaning death. It causes death. And the end part of HIV is called the AIDS, and this means somebody that has untreated HIV infection, and this would have run for many, many, many years, and sometimes some decades. You do not get HIV from kissing, from hugging, from sharing utensils in the households with people. You don't get HIV by saying hello to anyone. So welcome again to Medical Class 901 with Dr. Chi. Betty, I'm so happy to have you here once again. Thank you for joining us.
I'm so happy to be here because I had so many questions, plus I want to learn, right? Because I have nieces and I have nephews, and when I learn, then I can pass that on. So I thank you for giving me this opportunity to learn something, okay, from a specialist. Okay, so we're talking about HIV. So, okay, is there a way for people to, who would want to know before they have HIV, and is there a way that, what am I trying to ask? Okay, can you go someplace to get pre-testing and to see if you have it? And if you have it, what happens after that? I think that's what I'm trying to ask the expert here.
Absolutely. So again, know your status. That's basically what you're trying to say, where the only way for you to know would be to get tested, all right? And so we encourage everyone. The CDC actually encourages everyone from the ages of 13 years up until 64 to get tested at least once, just so you know where you are. And so the question would be, let's just assume, theoretically, you get tested and you're positive. What do you do?
Okay, yes.
So you have to get plugged in with one of the healthcare providers, of which I'm one of them, to start you on treatment immediately. The treatment is called ART, antiretroviral therapy. And what this does is to kill the virus in the body. So one important thing I'd like you guys to know is that HIV actually does not kill. What it does is that it destroys the body immune system, which is that part of the body that helps us fight infection. So it stops your immune system, and your body lacks the ability to fight an infection. And so what happens is that very small things, small infections that under normal circumstances your body can get out, like, no, this is not a problem, becomes a problem. And that's basically what HIV does. So if anyone gets tested and it's positive, I know it's shocking.
Yeah.
Most times people are going to take, a few days, a few weeks, to get over the shock. then go online, just Google, hey, HIV providers. You can go to the Shelby County Health Department. You can go, there's so many places around the Memphis community where you can get plugged in and get started on your medicines immediately. The sooner you get tested and the sooner you know what your result is, and if it's positive, the sooner you get put on antiretroviral medication, the sooner your body's going to come back to normal and you will just live your normal life like everybody else.
Okay, but can you, once you get on your medication, can that person still, if they say like if they had sexual intercourse with somebody, can they still pass it to another person?
Okay, yeah, absolutely. That's an excellent question. So what happens is that, like I said, the HIV virus walks by eating up your immune system, okay? And so this part of the immune system is called the CD4 cells. Those are the cells that help us fight infection, and that's what the HIV virus destroys. So what happens is that when the CD4 cells are no longer active or no longer working, then the virus keeps multiplying in the body. And so what that medication, when we put people on HIV medication, what it does is to kill off that virus, reduce your viral load, and then increase your CD4 cells so that your body immune system comes back to normal. And so you can transmit that infection if your viral load is still high. So what we try to do is to get everyone to an undetectable viral level.
Okay.
So what that means is that when the the HIV viral load goes from, let's say, 10 million copies at the time of diagnosis to less than 20. So when it's less than 20, some people say less than 50 counts, then you are undetectable, and it's very, very, very unlikely for you to transmit that infection even if you have any kind of unprotected sexual intercourse. So that is what our role is, to get everyone that's HIV positive to an undetectable viral load or viral suppression. That way you are unable to pass that to the next person. The group that's most affected would be the Black man who we call,
in the closet?
Yes, you can say that, or we call it MSM, like, males who have sex with males, or, some people call homosexuals. And after that class will be Black women. So, heterosexual women, Black women. So it does affect everybody.
Okay, so Memphis ranked number 2. So how did we get here to be number 2 in the nation?
Yeah, it's heartbreaking. So we are number 2. We're only second to Miami in terms of new cases of HIV diagnosed in our teenagers from the ages of 14 years to 19 years. And so it's devastating. It's something very devastating. So clearly there's something we're not doing right. Okay. And part of it is what we are doing right here, which is education, because part of what our problem is not having enough knowledge. We talk about, just because you can't do something when you don't know. So we have to educate our communities. We have to educate our teenagers. I have teenagers at home. We have to talk to them. This is the reality. It might be something that's a little bit embarrassing, for people or parents to talk about, but this is reality. And so we, as parents, as adults, have to get up and do our own part. Sit down and have these talks with the young ones. Let them know how HIV can go from one person to another. Talk to them about their sexual preferences and, risk factors for contracting this infection, and also how they can pass it from one person to another. So I feel that if we're able to pass this information to our kids, to the younger ones, then, we'll be heading in the right direction. Welcome to Medical Class 901 with Dr. Chi. My name is Dr. Chinelo Animalu, infectious disease specialist and professor of medicine at UT Health Science Center, College of Medicine, Division of Infectious Diseases, Memphis, Tennessee. HIV for most part is asymptomatic. So what it means is that you might not know. It's, so what happens is that the initial infection, you might have what seems like to be like flu-like illness, and then it goes away and then you're fine. So it doesn't have any specific symptoms, and that's why we are pushing for people to be tested. So for our younger generations, for older ones like us, if you are sexually active, you need to know your status.
Yes.
Especially, if you are not certain of the person that you are involved with, everybody needs to get tested. That's the only way you can know. Welcome to Medical Class 901 with Dr. Chi.
Okay, let's jump back to the ER and recommendations for the health department. So the opt-out, are we talking about testing anyone and everyone, or just people that are in that risk category when they come to the ER for some reason?
Now, we're talking about testing every person.
Okay.
Everyone that comes into the ER,
okay.
regardless of what your age is, regardless of what your risk factors are,
Okay.
regardless of what brought you into the ER, just testing everyone. There's no age limit to, contracting an infection. And we talked about, not knowing your status. In clinical practice, I've seen people in their 80s positive, unknowingly, and again, yeah.
Really?
So that's.
I mean, they can have it that long and not know it.
Absolutely.
How long can HIV disease before it turned to the big one, the AIDS? How long can you literally have it without?
So HIV basically has 3 stages.
Okay.
Okay. The first stage is called the acute phase, or when normally it takes about 2 to 4 weeks or so. That's when you contract the first time when you contract the infection. And, you might just feel like flu symptoms for a few days and it goes away, and that's it. And after that, you're fine.
Okay.
No symptoms, right? And that goes into the stage that we call the chronic HIV. And you don't have any symptoms, you just go about your normal life. And this can last 10 years, 15 years, 20 years. Absolutely. And there's some people that we have a class of patients that we call them the non-progressors. They never progress to AIDS. Okay, and so they're dead. They're living their healthy life, no problems.
And passing it around.
Well, depending on your lifestyle, so it depends on the lifestyle, but absolutely you can pass that around if the levels are, high, or, there are hundreds of thousands and so. And so the end stage would be the AIDS. And that is the point where your entire immune system has been destroyed by this virus. And that's usually the time where we see people in the hospital. They now show up with, some crazy, we call it opportunistic infections. And once we see that, we're like, oops, okay, we have to test for HIV because this is not something you would have normally. Yeah. So.
Yeah. And, I mentioned that, my nephew passed with it. And it was, back then it was so devastating because obviously that was before they had the medicines that you all have, to provide now. And I tell people, if you ever see anyone pass away with that, you would do everything in your power to not get it if you don't have to. But, so what do we do? I mean, education, of course, but what other steps do you think infectious disease specialists like yourself can do in the community, through the church, through schools? So what do you think would be a good way for you to get out there, for you all to get out there and try to educate? I guess to start with what are young people?
Absolutely. So I think it would be nice for us to actually go into schools, especially our high schools, because that's where you're going to see the highest age range. Go to our different high schools in our communities, go to churches, and kind of talk to our young kids. Like I said, this, HIV, just like other STIs, it's something that's a little bit embarrassing, to talk about. No parent wants to talk, discuss STIs or, HIV. It's so, and the kids don't want to hear it either.
No.
I have my daughter who is in high school, and I tried to talk to her about HIV, and she's like, "Oh my God, Mom, please," and that's what happens with all the kids. They don't want to hear about it, but we just have to find a way to educate them. Again, I have asked, high schoolers, how do you think HIV is treated? And they say, oh, you take antibiotics. Of course not, and it bothers me because I can tell that they have absolutely no clue. So we have to find out, find ways to go into our communities, go to the schools, go to the churches, go to, YMCAs, wherever you have aggregation of, young kids, and talk to them and just kind of educate them, and so they will be safe.
Question, because Memphis, of course, we're supposed to be on the Bible Belt, right? For some reason, parents think sometimes if they don't talk about things that have something to do with sex, that maybe they won't have sex. But do you think if it wasn't about sex, that it'd be easier for parents to have that conversation?
Probably, again, the age group we're talking about is very young, and, parents might also feel like, maybe they failed in their own duties, letting, kids this age, but, it is what it is. This is the age where we are. And so we as parents also have to come out of that mindset and know that this is our reality, and we have to do what we have to do. So.
And the kids are not going to call home and ask for permission.
Yes.
To do what they do, right? So you have to me, be in front of it, because they're not going to call home and ask, can I do this tonight, right?
Yes.
And that could be the night that they get HIV, HPV, or whatever it is, because HPV is,
rampant too.
Yes,
Absolutely.
it's out there too, and a lot of people won't talk about it because it's like saying they don't want to say they have the cervical cancer, for instance, because they think they're going to be judged.
Yes.
Because it's a sexually active disease as well.
Yes.
Well, does infectious disease specialists also deal with HPV?
Absolutely, we deal with every infection.
Oh, because that is transmitted, right?
Yes.
My God. So when do you all get a break? You don't.
Well, that's what our lives are about, and So it was nice having you on the show, Miss Betty. The HIV topic, is a huge and very extensive one. We still have some things we have to share with our audiences, especially what do you do?
Yes.
If you've been exposed, right? Let's say you had some, sexual encounter with somebody, you find out that person is positive or whatever. What are you going to do? So that's going to be the topic that we'll talk about some other time.
Okay.
So thank you for joining us. This is the Medical Class 901 with Dr. Chi. I am Dr. Chinelo Animalu, Infectious Disease Specialist and Professor of Medicine. Thanks for joining.
Thank you for watching the Medical Class 901 with Dr. Chi. Dr. Chi MD is a renowned infectious disease specialist in the Memphis community.
My name is Dr. Chinelo Animalu, and I am an infectious disease specialist out of Methodist University Hospital and a professor of medicine, Division of Infectious Diseases at UT College of Medicine. Infectious disease is a specialty that basically deals with managing or treating various types of infections. It could be bacterial, it could be viruses, it could be fungal. I grew up in Africa, and I did experience a lot of infections, and most of them were childhood infections. And as a child, I was really curious, like I could not understand why there was so much illnesses, especially infections. And so that was where my curiosity came from. And I knew I wanted to become a doctor.